They say the average American's 2 paychecks away from being on the street, and I believe that that's true because I would have never thought that I would have went through what I went through with a master's degree.
Food insecurity is very important as a political problem and also as a health problem.
Food, just on a basic level, is very vital to just human life.
Using food as medicine is it's the original Hippocrates, let food be thy medicine. And we've moved so far away from that we think a pill can solve all of our chronic diet-related illnesses. Instead, it's really actually this kind of healthy food and exercise and active lifestyle and intention to live that way.
So I went to Columbia for undergrad, prestigious university. I have a dorm, I have somewhere to sleep. I consider that to be wealthy. But the moment I lost that, I had a home, I had everything else, but I didn't have food, and I felt that poorness. I kind of had that stress of like, what am I gonna eat next?
The face of poverty and food insecurity is different. It's no longer, poor people. It's people who work 2 jobs. It's college kids who can afford to get into college but can't afford a meal plan.
How many here, raise your hands, know somebody that faced hunger or yourself faced hunger? Raise your hand. Keep on looking. Look around. We're all touched by it, aren't we? Thank you. And every time I make this presentation, there's 1 or 2 people that have become so choked up and tearful. And it's because it brings back memories that they had suppressed growing up in regards to food insecurity.
It's an issue that needs to be addressed with some priority and some resources behind it.
The United States Department of Agriculture defines food insecurity as a lack of consistent access to enough food for an active, healthy life. More importantly, why should we even care? It turns out that 42 million Americans were food insecure in 2016, and that includes 13 million children. That means that on average, out of 8 Americans you see, 1 of them is food insecure. In October 2015, the American Academy of Pediatrics issued a policy statement that recommends universal screening for food insecurity. They promote using a 2-item screening tool now coined the Hunger Vital Sign. The first statement goes, within the past 12 months, we worried whether our food would run out before we got money to buy more. The second is, within the past 12 months, the food we bought just didn't last and we didn't have money to get more. If patients respond often or sometimes true to either statement, they are considered food insecure. With the help of the staff, my mentor Dr. Okafor and I implemented this tool successfully into electronic health records at Cornell Scott Hill Health Center in New Haven, one of the federally qualified health centers which provides health services in underserved areas. We found that in over 2 months, 41% of patients were screened positive for food insecurity.
Food should be one of the most important social determinants to screen about because it also has direct relationship in terms of one's health condition, especially chronic diseases like diabetes, obesity, and others. It's also important for adults because they need to eat in order for them to be able to function effectively, go to work, be active contributors to their community, earn a living in order for them, those that are parents, to take care of their children. So food, just on a basic level, is very vital to just human life. So screening for that is so important so that as physicians and clinicians, you will know what to treat and write prescription for the right condition, what's causing the symptoms, not only the symptoms that the patient bring to your offices when they meet with you.
I'm one of the foundation faculty of this Frank Nater School of Medicine. My research interests are in diabetes and endocrinology. Where there's food insecurity, people don't usually have options, in the sense that what they eat is what they have. And most of the time it's mainly carbohydrates, deficient in protein, trace minerals, vitamins, and so on and so forth. So if kids are malnourished, then they're going to have varying issues, brain development, including mental development. The beauty of it is that there can be catch-up growth if the child then has access to nutrition. And that's why when you see feeding of children in refugee camps or in war situations, a lot of them can resume normal growth and achieve normal adult weight and height.
It was both surprising and eye-opening to learn that one of our own medical students had gone through this.
I went to school with kids that had clear signs of iron deficiency, the spoon nails and things like that. I was lucky enough to get a scholarship to go to boarding school in Connecticut, so that alleviated some of the burden my mom had to provide food for me as well. I remember that that point when my mom started working more, I remember just feeling wow, we don't have any food in our fridge. And that's kind of how it went. So as soon as she started making more money and she wasn't qualified anymore, we stopped having food in our fridge. So she was not able to get access to the healthy, nutritious meals that we had before. I just remember coming home, when I would come home and being wow, there's no food here, or we would just have cereal, or we would just have things that crackers, things that I wasn't really excited about. I should be happy that there's at least crackers. My doctor was you're gonna become you're gonna be obese, and I was just and he was just what are you eating? I'm just this. I was listening to what I was eating, but it was just he was just oh, this is not healthy. I'm just this is all we can get.
Many of Kushenta's experiences and perspectives are similar to those of the children and parents featured in the documentary A Place at the Table. As medical students, we need to be able to absorb a huge amount of information as efficiently as possible.
How am I supposed to be up at 8 a.m. in the morning having a full conversation in class, participating, if my stomach is growling, I don't feel good, I'm grouchy, because when I don't eat, I get impatient, my emotions take over.
Food insecurity can happen at any point of our lives, depending on what situations we unfortunately find ourselves in. For instance, divorce and losing a job come to mind. Another population being hit are college students, especially because they are faced with the extravagant prices of higher education and the burden of loans.
It gives you the chance to reflect. Yes, you have now, but there might be a time that you might not have food in the future.
So, what would happen if you started asking that question and they said, yes, I am basic food insecurity? What are you going to do next?
I'm a pediatric rehab specialist, and I've been the public health officer for Orange County, California for the past 10 years. Waste Not OC is a coalition that's focusing on ending hunger in Orange County, and it's a three-pronged approach. We're getting restaurants and grocery stores to understand that you're not held liable if you donate the food. So our environmental health specialists, when they do restaurant inspections, have a one-page informational sheet saying in effect that you're not held liable, and we encourage donations. The second prong is identifying people who are food insecure by having hospitals, family resource centers asking 2 questions. And if the families say yes, then they're referred to a Google map where all the food pantries are put on that, and they just click on a pin and insert their zip code, and it tells them the nearest pantries to them.
My name is Nicole Strait, and I'm the Fairfield County Site Director for Food Rescue US, and we are a national organization. What we do is we work with volunteers, and we're app-based, which means that everything we do is from our phone, and we make it very easy for volunteers to come, what we call rescue the food. Other organizations that rescue food, that sometimes rescue canned food, which is, certainly valuable, but, it's very important to have fresh food. We need to have access to fresh food and fresh protein, and, the meats are always very valuable because meat is expensive, and while canned food is okay, the fact that we can rescue same day, it doesn't have to go to a pickup in a truck and then go to a warehouse to get sorted through. I mean, it's a direct delivery.
Joy Johannes. I am the Executive Director of the Storehouse Project, which is Soup kitchen, food pantry, we call it community dining. It started in a closet in the church here at Cornerstone Christian Center. We provided approximately 248,000 meals on a $20,000 budget, and we have 148 volunteers. Why is food insecurity so important? I feel like it's important because when I was growing up, we didn't know that we didn't have a lot to eat. My parents didn't really make that known, but there were times where we didn't have a lot. My father went days without eating. When I was in college, the last semester, I sold my bicycle so I could buy bread so I could eat toast the whole last semester, and that's really what I lived off of. It was a very difficult time, and so people don't think it will happen to them, but it could happen to any of us.
My name is Jacqueline Maison-Pierre, and I'm the Executive Director with New Haven Farms, which is a nonprofit based here in New Haven, Connecticut, with the mission of promoting health and community development through urban agriculture. Our model is really unique because we work with primary care providers in New Haven. Our main program, our signature program, is called the Farm-Based Wellness Program, and it happens right here on this farm where we are. There's a tent to my right here. We do hands-on cooking with our participants, and then we have the really unique addition that it takes place on a farm, and families are learning about food production and take part in a little bit of the harvest, and then are sent home with the produce at the end of each session. So we have our families for 20 weeks, so they come out to the farm once a week for 2 full hours, and so they're doing half an hour of gardening, a short seated meditation, because we really see the impact that mindfulness can have on people, and it's really stressful to live at the poverty line and be struggling with chronic diet-related illnesses, not just yourself, but usually it's a lot of people in a family. So we have families that are actually referred by their primary care providers, either from Fairhaven Community Health Center, Cornell Scott Hill Health, or Yale Primary Care.
I think the biggest thing here in America is just the lack of knowledge around it. I think that people know it happens in other countries, but they really don't know the level that it's happening here. And having worked in other countries and having worked in famine and seen the effects of that, to me, it's not just a social barrier, but it's a financial barrier.
The root cause is not that there isn't enough food, it's that people don't have the money and the resources to purchase the food because they don't have the opportunities to have the right kind of jobs, and education is a problem, so it's a rippling kind of effect.
I have worked in like food pantries or feeding programs or after-school kids programs for probably 25 years. And the disparity and the gap to me is just getting larger and larger from what I saw 25 years ago. So there's just a big gap right now, and I think the other thing is the working poor, the people that are working, that are struggling, that are not paying their power bill, or they pay their power bill but they don't eat.
In a country with so much wealth, we actually have a lot of food, but it's just not being distributed properly. One great example is delineated in Anthony Bourdain's hour-long documentary called Wasted, the story of food waste.
The biggest problem that we encounter is that donors are worried about being sued.
There is a viewpoint of looking down on somebody that says that they're in need. And my experience has been when somebody first knows about or hears about somebody, there's a prejudice against, oh, well, you're that kind of person.
If the individual says that he doesn't have enough food for his or her kids, will social welfare take the kids away? Or it also impinges on personal pride, because then you're dealing in human ego, forcing them to accept their poverty, exposing themselves so much to the system in terms of saying that they have needs. Some people feel their personal ego is going to really be bruised.
And I did apply for food stamps in New York, and they gave me $15. Like, you're supposed to feed yourself every day for these 30 days with $15. And I was like, this is borderline disrespectful now. Because like, now you're not respecting me as a person. I'm coming to you because I need help, and you see that I don't have any money, and you're only offering me $15. I'm going to be paying more than $15 in taxes in the future. I won't be able to make it there if I'm unable to eat, or if what I'm eating is going to make me sick.
I've been in clinical practice for 31 years in Bristol, Connecticut, and about 4 years ago I became chair of the Department of Family Medicine here at Quinnipiac. So I'm in a clinical practice in what would be deemed a blue-collar community, and I don't really have a good handle on the degree to which my patients struggle with food insecurity. Even though I take care of patients on fixed incomes in Medicare, commercially insured employed patients, and people insured by Husky, which is the state Medicaid program, I don't ask them about their difficulty in terms of procuring healthy foods other than make recommendation to them. I haven't asked them specifically because I don't know what I would do with the information. We really need to figure out, given the time and financial pressures and documentation pressures that exist in primary care, how do we address food insecurity, transportation limitations, housing issues, cultural competency, none of which are on the patient's agenda or consciously, and meet their needs during the office encounter, as well as understand the nature of our population's needs. That's the challenge.
It's very overwhelming to see that there are so many obstacles to solving hunger or food insecurity. But as we've already just witnessed, there are many people who are passionate about taking the next step and helping the ones who need it.
So that was my groupie.
One groupie.
There is a need for collaboration between all persons that are in position to influence food insecurity.
Faith-based business organizations, the fraternal organizations, I think we're all going to have to rise up more than we have in the past. I think that in the 1920s when the Depression hit, that's who was doing all the food, providing food for people that didn't have it. And then sort of the government came in and took over a part of that, and I think we need to lean back more on those agencies, and then through those agencies, and then I think through education. I think what you're working on is fantastic, and the reason that I think is so important for medical facilities and doctors to ask if people are food insecure is because just this last week I ended up in the hospital and I had food poisoning of all things, which then settled and got throughout my whole system and attacked my lungs, and it was horrific. So the last 5 days, 6 days, I was in pretty bad shape, and I noticed they went through, do you feel safe in your home? All the screening questions, and I kept wanting them to say, that other screening question.
We should make food insecurity like a medical condition, at least for children, because that's a person's entire life that we're playing with.
In fact, the student-run free clinics at the University of California, San Diego have already done this. They include food insecurity into the problem list, and providers are reminded to ask about this in subsequent follow-up visits. In 1996, President Clinton signed the federal Bill Emerson Good Samaritan Food Donation Act, which essentially protects food donors from liability as long as they are certain that the food has been handled safely according to food handling guidelines.
Donors are worried about being sued, and what they don't realize is that there's a federally mandated act, the Bill Emerson Act, and it was a way to encourage people to donate food without worrying about being sued.
We have always done a food security screener in our intake, so we collect, we do an intake screening and then an exit survey and then collect weekly data to see how people are using the produce. We weigh them each week to keep them on track in terms of their health goals. And so we've seen that this program can reduce food insecurity, but only in a short-term period in terms of when we actually have families at our program. We're able to report the amount of food insecurity that our participants have, and it's more data to provide to places that we get grants from and other funders and just the community at large to really say this is a problem that's in this community.
If where you are you don't have a system like some of the things we started building in New Haven, start. Be the leader. Start food reclamation. Set up a small pantry. Allow people to donate. donate and take foods from your clinic, from the hospital.
Finally, the first step to overcoming social stigma is to open up the discussion.
It looks like they're having a tough day or having a hard time, check in on them, see what's going on, and, offer your help if you can help. You can't tell someone's situation just by looking at them.
Empathy, compassion, and really look at yourself as far as are there judgments there, and try to put those aside to say, what if this was your mom? What if this was your family member? How would you treat them? And treat them that way rather than with some kind of bias.
Medical or healthcare associations should be talking about this, be leaders in addressing this. In America, with the tons of food we produce and sometimes throw away, children should not be sleeping hungry. People in education should be talking about this. It impacts kids' ability to study, even adults' ability to study in colleges, So if everybody is talking about it without feeling ashamed of it, but saying that this is the least we can do, food. We have the resources. We just need to get it to the people that need it.